The sacrum. This is nothing more than 5 fused vertebrae. And you can see that right here. 1, 2, 3, 4, 5. So an adult, it's going to fuse together, forming one sacrum. But at one time it was 5 individual bones. The auricular surface, or the auricular surfaces, you have 2. It's a joint surface. It's the joint surface that can articulate with the coxal bones. You have it on both sides. This flared portion right here that I'm rubbing, that's the ala. That's actually the lateral portion of S1, which would be your first sacral vertebrae. As I mentioned earlier, this is nothing more than a 5 fused sacral vertebrae. In an adult, again, it forms just one sacrum. Anyhow, the ala is this flared portion right here, and the auricular surface is the joint surface. The sacral promontory, the ridge, that's actually a pelvic landmark. In obstetrics, they do use that in a pelvic exam. It is used as an important. I don't know if they still do it today or not, but what a doctor would do, they would actually insert their finger in there, can feel that promontory. I guess that would be an indication of how the pregnancy may go, or how the delivery may go, not necessarily the pregnancy, but the delivery. I'm not sure if they still use that though, but that's considered an anatomical landmark. The transverse lines, just like the name implies, that's just where the different sacral vertebrae have fused. This is the anterior portion, and this is the posterior portion. So you can imagine the median sacral crest would be nothing more than the spinous process of the sacral vertebrae. The sacral canal is nothing more than an extension of the vertebral canal. And the hiatus, which you don't see very well on here, would be the bottom opening, right where the pen is pointing, right here. So the bottom of the canal, the bottom opening would be the hiatus, the sacral hiatus. You have the anterior and posterior sacral foramina. These would be the anterior sacral foramina. These would be the posterior. The anterior sacral foramina, blood vessels pass through there, as well as the anterior branch of the sacral nerves. Posterior sacral foramina, the posterior branch of the sacral spinal nerves will pass through here. Median sacral crest. And then you do have the coccyx bone, which is either 4 or 5 fused vertebrae. And it really doesn't have a function. It does provide minor support to some of the pelvic organs, but other than that, it really doesn't have a function other than that. It's just minor support. So, coccyx bone. Again, 4 or 5 fused vertebrae, then you have the sacrum. Again, the auricular surface would be the joint surface that's going to articulate with your coxal bones. All of the wing portion, sacral promontory, anterior sacral foramina, then you have the posterior sacral foramina. There you can see the canal a little bit better. The hiatus would be the bottom opening, which you really can't see that well. It's kind of, plastic has been, it filled up that canal. Sacrum.